rented this space. It's an 8-room space that we have completed renovation of it, and you really helped us raise the funds to do this, and hired 20 dedicated full-time healthcare providers, so that we will be able to actually have staff that we can support and retain them so that they are not fleeing to other countries. When we rented the space, it was empty, and we renovated it so that some of you have been to this center. We've renovated it so that we've divided it into different units, and it looks like this now. This is going to be our main primary care area. And then we have an eye specialist area, we have a dental area, we have, I think I have this here, we have a bathing clinic. Women can actually come to our center and feel safe, that they can give bath to their children safely, and we'll be able to actually take care of them that they are being taken care of now. You remember I mentioned to you about the diagnostic center. We have an ultrasound, we have an X-ray machine, we'll do some coloscope screening for women, we have microscopes, we have centrifuges, and we are so grateful for this because we collaborated with Doc to Doc, an incredible organization, and we are so grateful to have its founder here, Dr. Bruce Charash, who really helped us source this medical equipment and ship it to Kenya. Many of you have had the horrible stories that happened in getting the medical equipment from the port to the clinic. But we really worked very closely with Dr. Charash to get the equipment for us and ship it to Kenya. So thank you, Dr. Charash. But this is why we are here, friends, because if you go to any of the clinics in the area, you find a lot of empty shelves without any medicine at all. This is very typical of almost all the medical clinics that you can find in the rural areas of Kenya. As I mentioned to you, we are going to be one of the few clinics in the area that will actually have a pharmacy in the clinic, and we would like to avoid this. We want to make sure that our clinic is really filled with the medicine that we need to be able to support our patients as they come in. So we are here, and with your help, we would like to ship a container of medicine to the treatment center, so that again, as we did with the medical equipment, we'll go back to Dr. Charash again to help us to ship the container to Kenya, so we can fill our shelves. And going forward, we expect our treatment center to be in operation for the next 3 years. We have a grand opening next month. Again, thank you to you, because with your help, we've really built a center that I think is a model for the different clinics in the area. We expect to run it for the next 3 years. And then while we are doing that, I have not forgotten that dream at the beginning of raising $1.5 million for building a medical center. If you know Angelina Jolie, please let's talk after tea. And then we would like to really get into international healthcare exchange, because a lot of the diseases that are in Africa and in the rural areas of Kenya in particular are not typical of what you would find in the US. So we would like to get some physicians there to learn about tropical medicine, and then get some of our staff to come here to learn about some techniques that would be useful. Then again, we could not do this work without your support and without sponsors like this. We've gotten some sponsorship from Rotary Club. We worked with Doc to Doc, as I mentioned, with Dr. Charash being here. Dr. Charash worked with Project Q, and we were able to get the medical equipment to Kenya that way. We got a small grant from Johnson & Johnson, and that's how we were able to ship the medicine to Kenya. And then, most of all, this huge sponsorship probably come once in a while. But what I really wanted to say from the bottom of my heart, thank you. Really thank you, because without your support, we would not get this fund, we would not get the progress we have made. So I am just so grateful to all of you for being here and for supporting us to really get this work moving forward to help the people of rural Kenya.